Right. Good morning, everyone. Thank you so much for joining us today. We've got a really great informational webinar planned for you, and I would like to first introduce our two wonderful speakers from Harbor Regional Center. Our first speaker is Griselda Torres. She is a client services manager. Griselda is a dedicated professional with a master's degree in marriage and family therapy. She brings over 8 years of experience to the field, specializing in working with families and children with disabilities. She has made a positive impact by expanding her expertise in providing comprehensive support to individuals with developmental disabilities and their families. Throughout her career, she has remained deeply committed to offering comprehensive mental health support to families facing various challenges. Her expertise lies in providing counseling and therapy services tailored to address the unique needs of families and individuals. Griselda collaborates with families to understand and navigate intricate dynamics, strengthening bonds and enhancing overall well-being. Our second presenter today is Maria Magdaleno, who is also a client services manager at Harbor Regional Center. Maria is a highly experienced professional with a master's degree in advocacy and social justice. She has dedicated over 9 years to making a positive impact on families and underserved populations. Her extensive background includes working in crucial areas such as youth and foster care, early childhood, and marginalized communities. As a fervent advocate for holistic well-being, Maria takes joy in witnessing families thrive and achieve their goals. She places special emphasis on fostering positive relationships and guiding individuals to reach their full potential, contributing unwaveringly to the empowerment of communities and leaving a lasting mark on the lives that she touches. Once again, thank you all for joining us, and give a big warm virtual welcome to Maria and Griselda. Ladies, I'm going to turn it over to you if you're all ready to start sharing. Thank you.
Yes, we are ready. Well, first of all, I just want to say welcome, everyone. Thank you for joining us. We did not anticipate this level of interest in this topic, and we are super excited to have all of you here today. So my name is Maria. I am one of the client services managers here at the Regional Center, and I am going to go ahead and start sharing. Give me 1 second. All right, everyone, welcome. So just putting a face to the name, we both will be sharing lots of valuable information today regarding the Regional Center and what is it that we do as a whole, how we support families, and how we are here to collaborate with you all. All righty, some of our learning objectives, understanding regional centers and age-related services, really knowing what regional centers do and how we provide different services for children of different ages, milestones and delay recognitions, using tools and tracking tools to better understand how children should develop at certain ages and be able to refer if there are issues with any child development with children that you're working with, familiarity with assessment tools, learning about the different tools regional centers use to assess children, different names that we may not be familiar with in the community, the types of assessments that we use, directing clients to regional centers, guiding families to the right place when they need help for their child, and knowing when other options are a good idea, and collaboration and resource allocation. So exploring how home visitation community partners can team up with other regional centers and agencies in your community to ensure that families get the support that they need. If you have any questions, comments, please feel free to drop them in the chat. Laurel and her team are helping us with monitoring the chat. Griselda, you're also there. So if any of you ladies see any comments, please feel free to stop me. I can answer, or we can wait till the end of the presentation. All right? All right, everyone. So what is it that you see first here on your screen? This is the network of regional centers that we have across the state of California. A regional center system is a system that's available all across the state. So we have 21 regional centers that serve California. Just 8 of those are located in the Southern California region. So if you think about it, 33% of the regional centers that we have available are located in that Southern California region. Okay, most families, community providers may log into our DDS website that's located up at the bottom and search up the zip code to see what regional center serves the area that you are currently working with, the families that you are working with, okay? Sorry, ladies. Oh, I don't know what's going on. This is just our catchment map here. This is HRC's catchment area. This is the area that we served. Just as a friendly reminder, every regional center across the state of California has a catchment area that they are assigned to. And we really service areas based on zip code. We are not based off on SPA regions. So I know that many public health agencies are based off on certain SPAs. These are the areas that they serve clients. However, regional centers, we service clients based off on zip codes. I also want to emphasize that although we are all governed under the same set of laws, the Early Start laws or Lanterman laws, we may operate a tad bit differently. So although our goal is the same, which is to support and provide services to family, we may go on about providing those services and supports just a little bit differently, okay? But for us, we service the beach cities all the way to Norwalk, Cerritos, Long Beach, Bellflower, Carson, Wilmington. So if you have any families that are being serviced by any of these areas, we are the regional center that you will be referring to. All right, so now to the good stuff. So early start and eligibility criteria. So for regional centers, we have three eligibility criteria that we utilize to determine children eligible for services here under the regional center. The first one is developmental delay. Developmental delay requires that a child exhibits a delay of 25% or more in any of the areas of development. That includes cognition, language, expressive and receptive, gross motor skills, fine motor and gross motor, social emotional, and adaptive skills. Okay, high risk. This really indicates that a child is at a high risk of having a developmental delay due to a combination of biomedical factors, which are typically diagnosed by qualified personnel. So typically, these are more medical in nature. They may include conditions such as prematurity, low birth weight, assisted ventilation, neonatal seizures, and prenatal exposures to substances. I do want you all to make note that prenatal exposure to substances is something that we typically see with DCFS referrals. And this type of referral should be, the prenatal exposure should be documented in medical records. We often receive referrals from DCFS with no medical or health passports. So the health passport really helps us support eligibility under this criteria if the child is not found eligible under developmental delay. And the third eligibility criteria is established risk. Established risk exists when a child has a condition that has a high probability of resulting in developmental delay. And these are more genetic in nature. So if you're thinking Down syndrome, mosaic syndrome, DiGeorge, these are all conditions, genetic conditions that would determine a child is eligible under established risk. These would require that our medical personnel review medical records as well to determine that eligibility criteria. And of course, a child would be determined eligible for services under the regional center. So what happens when a referral is made to the regional center? Most regional centers have an intake department that will contact families and schedule the initial developmental assessment. This developmental assessment is usually conducted by a qualified therapist that will assess all areas of development. So this comprehensive assessment will assess, again, that cognition, adaptive skills, communication, social, emotional, physical, and fine motor. I want to point out that not all regional centers will have a therapist complete the assessment. Sometimes if the child is referred from the NICU or from a medical provider, they may already come in with an assessment that was completed through a practitioner. So we can also review those records to see if a child meets that eligibility criteria for regional center services. We do have multiple meeting options. So DDS does continue to allow us to meet families in person, hybrid, virtually. We want to make sure that this assessment does not create a challenge for the family. So we are able to meet the family anywhere they would like. If transportation is an issue, we can meet them at home, we can meet them virtually, and really assist them and assess for eligibility center criteria. I wanted to talk a little bit about the type of assessment tools that we see across regional centers. Here at the Harbor Regional Center, we're typically using two of the assessment tools that you see noted on here. That's the BSID-4, so it's the Bailey Scales of Infant Development 4, and the DAISY-2. Both of these are completed by some of the therapists that, by all of the therapists that we have that are vendored as part of our regional center. But again, there's 21 regional centers across the state. There is no one standardized tool that we use across all of them. You see a variety of these. Some of these are based off on parent report, such as the DAISY-2. The only issue with that is that sometimes parents can over-report or under-report. So we want to be cautious when our therapists or anyone we're receiving those types of reports. We want to confirm that all the information is correct. The BSID-4 or the BSID-3 do have the child complete a task in front of the therapist. They're putting the child to put the pegs on the pegboard or complete a puzzle, identify colors, sort by color. So they're actually seeing this live happening in front of them. We also have the HELP, so that's the Hawaiian Early Learning Profile. This requires an observation of the child in multiple settings, parent interview, or play interaction with a child. We typically see this at centers, right? There's groups of children, so a provider is out there observing the child in a group setting. This is when we're most likely to see it. The DP3 and the DP4, that's Developmental Profile 3 and Developmental Profile 4 is a parent caregiver interview. So we're again going back to that parent reporting checklist provided to parents. Parents are able to check out what is the child doing, and if there's any other home visitor or a teacher that's also working with the child, they are able to provide input as well.
Maria, can we pause a little bit? I was trying to respond to the chats, but they're kind of coming in.
Yeah.
Quickly, so if we can just take a quick so that we don't go too far along and forget. So one of the questions is, if a parent is part of Harbor Regional Center, does the child automatically get services? You know, we believe we assess individually. So it depends also on the age. We would do an evaluation, or if they're over 3, we would kind of do an intake. More than likely, yes, under high risk, the children can come if it's under 3, but it's case by case. But majority of the times, if the parent is part of the regional center, we support with the child as well. Then the next questions, are there psychology evaluations? What ages? We are going to get into that a little bit later in the presentation. Yes, we do psychological evaluations for eligibility over the age of 3.
Yes, and Griselda, I just wanted to add for the question regarding parents that are served by regional center clients, if they are under 3, so 0 to 3, that is considered high risk. The parent does have a diagnosis through the regional center, so we would make them eligible from 0 to 3. There's a different criteria for after 3, and Griselda just mentioned it. So we'll talk a little bit about that. The child still has to go through the assessment to see if they are eligible under those services.
Then the next question is, were genetic factors considered established risk?
Yes. Some genetic conditions are considered established risk. We would have our team, we're not medical experts, unfortunately. So we would have our medical team review those records to determine if any of those factors would qualify a child under any of our genetic criteria.
Thank you. I didn't quite understand the question, but glad you did, Maria. Then can regional centers say no to doing an assessment in the home environment, or does it happen on the regional center? No, we offer to do our under 3 in the home or at our agency. Sometimes it even takes place in the community. It's really, we're all about parent choice. Whatever makes them feel comfortable. Services are rendered the same way. They can be, depending on what the recommendation, it can be in a agency setting, or it can be conducted in the home. Does being a teen mom in foster care automatically mean your child qualifies for services based on high risk? No. That teen mom wouldn't, unless the teen mom was part of, if the pregnancy was exposure to substance or any other trauma that we can discuss, but just being a teen mom part of the foster care does not qualify for eligibility.
Does every child have a right to be assessed at regional center regardless of age, even if they already have an IEP? Yes, every child has the right to be assessed at the regional center. If the parent has expressed a concern, you are sending that referral right away. The IEP is a completely different process from regional center services. So I just want to clarify that. And we'll touch a little bit upon it in some later slides. But yes, every client can come to the regional center to be assessed.
And kind of a tool we always, share is that every regional center client will have an IEP, but not every student that has an IEP will qualify for regional center. So they do not exchange equally back and forth, if that makes sense. Then, does a child with ADHD qualify for social skills? ADHD is not one of our eligibility criteria. So if there's just solely that diagnosis, then they would not qualify for regional center to provide social skills. And OT services are considered an early childhood birth to 3 service. However, we cannot say, no, we will not provide OT services over the age of 3. Again, that's where I defer to the assessment. Everything is assessment based in order to follow our bylaws, being the payer of last resort and so forth. But OT is typically under birth to 3. Is that the same for long-term and intake assessment as well in terms of parent choice with the testing environment? So we have psychologists that can do it. It's a psychological evaluation followed with 2 observations. Yes, parent has choice, but there's always logistics involved. If a parent wants to have the kid observed in a park and the psychologist can't get there, then that extends the timeline. But yes, we are very much working collaboration with the parent as to what they prefer.
And the last one. What if the child has private insurance? Can regional centers still evaluate? Yes, we can. We can still assess. And we'll talk a little bit about those services, what happens when a family has private insurance or whether that's Medi-Cal or through an employer, all of that. So we'll touch upon that a few slides down the road. But yes, great questions, everyone. Thank you. All righty, and just to finalize here, so the Peabody is also typically used to assess gross motor development, and as well the Rossetti, we're usually using it in a care center setting. A lot of these are observation based, so they require the therapist to observe the child in what we call a natural setting. I want to also point out that it depends on the therapist. So the clinician completing the assessment will most likely use the assessment tool that they are most familiar with. So a speech and language therapist will typically use what we call a DAISY, the parents reporting where the child is based off on language. Our occupational therapists, our physical therapists, they're typically using the Baileys. They're using that to put the child to task, making sure that the child's completing task, really observing them in that setting when they're there. But it's really based upon the discipline and the provider that's assessing the child. Okay? All righty. So here's how HRC can help. Regional center staff, our service coordinators, or SCs for short, are really the family's primary point of contact during their journey here at any regional center. Our teams are here to provide support, information, resources, and to help families navigate the various systems that we have in place. And we're not just talking about regional center. We're talking about their health plan. We're talking about multiple providers that they may be working with, whether that's a school, a mental health agency. Our staff is equipped to help families navigate those settings. When we talk about health insurance, sometimes families are receiving mixed messages from their health insurance. Typically, health insurances are sending families back here. They're requesting us regional centers to pay. I just want to point out that regional centers are the payers of last resort. And you're going to hear that from the staff if you're ever interacting with any regional center staff. So we are going to help families connect to their insurance for services, because ultimately that is what the family needs to do. Our regional center services for early start end at the age of 3. We help families connect prior to 3 so that there is no lapse in services when that child ages out. Our service coordinators can help draft letters to providers. They can provide copies of the developmental evaluations, of those reports that we complete internally, and really to help them advocate for those resources with their health plans. So once a child has been assessed, they become eligible. The family will have what is called an individual family service plan, or an IFSP for short. And just so you guys know, we take the crown in acronyms. I think we have an acronym for everything here. So if you hear me saying OT, PT, SC, IFSP, we use that here all the time. So IFSPs are held every 6 months for every family. Families can invite anyone that they would like to attend. If they're working with a home visitor program, they can invite their home visitor, the teacher, friend, family member, community advocate. If they have a social worker that they're working with, anyone that they consider a part of their circle of support. An evaluation is held every 6 months to monitor that child's progress. Just as a reminder, the goal of early intervention is to help the child meet those developmental milestones and to support the family. So every 6 months, we're going to complete a new assessment to see if the child has made progress with these early intervention services. During those IFSP meetings, during those evaluations, the family has an opportunity to identify strengths, help develop goals and plans that are meaningful for the family, for their child, and identify any supports out in the community to help their loved one achieve the goals that they have set for them.
We have one more question, Maria. Is co-payment assistance available in early start families if they have private insurance? Absolutely. That is one of the factors we inform family when we're connecting to services that we can support with co-payment insurance. And for early start, we actually don't do an assessment of income to provide that assistance. Over 3, it differs. We do have to look at income in order to provide that co-payment assistance. This is the law, so all regional centers do have to conduct IFSP, individual family service plans, every 6 months. But again, as we mentioned earlier, every regional center has their own own business going on, but that is the expectation that we all follow the same timelines. Do foster parents receive the IFSP every 6 months? Yes. If they are part of DCFS, we also do invite the bio parent if they are the holder of educational rights. If they are not, then it's just held with the caretaker of our individual who we are serving. Sorry if the question has already been asked. How can we request and evaluate? For the site, we will discuss it further in the second part of the presentation, what happens after the age 3. So we'll go ahead and answer that question there. Does every regional center not count income for co-payments? Yes, that is law across. We do not assess financial to provide co-payment for early start kiddos. So that's birth to 3.
Yes. And that is part of our next slide. So early start funded services. What services can we fund for once a child has been made eligible and a need is identified? We do offer speech therapy, physical therapy, occupational therapy, center-based programming. So we're talking about those centers where the child can receive all speech, physical, and occupational therapy in one. behavior services such as ABA or consultations with a BCBA if the family is requesting just additional information on how to support the child based upon their behaviors, and co-payment assistance. We do not assess for income. All regional centers have the same directive. We do not assess for income for both copay and deductible under the age of 3. The law changes once that child turns 3 and is eligible for Lanterman service. So I just want to point that out there. These services, again, they're only specific for 0 to 3. Once a child has aged out of the Early Start program, it is the responsibility of the school district or the insurance to fund for these services. So this is why we emphasize we're going back to making that referral through the pediatrician, through the family's health plan to request speech therapy, physical therapy, or occupational therapy for the families. These services can be provided in a group setting or an individual setting. Group is typically in a clinic and in a provider's office, or individual is typically at home unless the family has requested to hold it, at another location. We do this because we want to accommodate the family's needs. We don't want services, to be a barrier for the family, to be a challenge. So we are meeting the families where they're at. The families should communicate with their service coordinator to see what can they commit to. We often make referrals for example, for center-based programming where the family has to take a child to a center 3 times a week, right, for 3 hours a day. Some families can't commit to something like that. Maybe they're working and their employer doesn't allow them to take time off. So they need to be communicating this information to their service coordinator so we can make the necessary accommodations so that the child can receive an alternative form of therapy. Okay, our primary focus is for that child to receive that early intervention. We want that child to make progress. So communicating with the service coordinator is important. With that being said, we do work with vendors. So the regional centers contract individuals to provide these services to children until the families connect with insurance. At times, these vendors can also be contracted through the family's insurance plan. We typically see this with like group speech therapy. We have providers in the community that are also vendored with insurances. So we do our best to accommodate the families so that the transition is easier, right? If regional center is funding for a service, they can transition with the same vendor, with the same therapist to now their health plan. But ultimately, our goal is to ensure that these services are in place for the family within 45 days of the family holding that initial IFSP meeting.
We have some more questions, Maria.
How
will parents receive the IFSP paperwork? We, at our intake, when we do our first meeting, we do what is the preferred method of communication for families. So that can be email, that can be phone, that can be snail mail, and that's what we do. And honestly, even if they say email, we do send it encrypted, we still put it in the mail for them to have hard copies. So that is part of the discussion at the first meeting. How do we communicate best with you? Do you know which WIC code that is tied for not assessing income? We are having challenges with another SC. So WIC code is for Lanterman clients over the age of 3. So that would apply. I don't have it handy. We can get it to you before this is over. But WIC is usually for age over 3 regulations. For early start is where we do not assess financials, but over age 3, income is assessed for co-payments. Does the regional center do evaluations? Yes, that is one of the criteria. We will get into that a little bit later in the second part of what are the different diagnoses we are looking at when we do a psychological evaluation after the age of 3. I think I skipped one. What does behavior services look like? Behavior services can look like an array of we have something called Together from the Start classes, which mimic mommy or daddy and me classes. However, they're led by clinicians. Either this would pertain to our BCBAs on site, understanding behaviors, how to deal with them, making plans. That is one aspect, or even as far as funding for ABA services. So it all depends what our family is needing assistance with and how we support that. But it can either be with classes or with services. If ABA therapy services are required, does Regional Center link into that, link the family, or we as a family providers? No, if they are a client of ours, and it should be, I think it's general knowledge that ABA services are in backlog for months and months wait list, and if not, then there you know. So yes, we will provide families. We will try to find alternatives in the meanwhile while they get services, receive services from the community, from their insurance. And then we would find if there is Medi-Cal, straight Medi-Cal, that's when Harbor Regional Center automatically funds for those services. If not, we are doing the same thing as other services, trying to connect them into the community. But because we all are aware there's about 6 to 9 months wait list for services, we try to supplement with other resources, either by us or in the community. Who initiates a center-based service for families? Is this based on need only? Yes. And Maria, do you want to take that one or just?
Yes, absolutely. Yeah, so regional centers will fund for center-based services. I want to point out that center-based services are not funded through the insurance plans. This is exclusively for regional centers. And that's because we've identified that this child needs multiple therapies. They may need speech, physical, and occupational therapy because we're seeing delays in multiple areas. So we are going to make the referral for a center-based provider. But it is based on need, it is based on that assessment. Our team will review and ultimately provide that service recommendation. And I'll take the next one.
And
Okay.
just to follow up on that is we are experiencing a shortage of providers across the state. So say we do have a family that needs a center-based program, there is delays in multiple areas, then we supplement by providing those services one-on-one versus center-based until we can place them into a center-based program. Then last question, does Regional Center fund for ABA or is that Medi-Cal's responsibility? As stated earlier, we are the payer of last resort. We will always try to connect to the insurance unless they have straight Medi-Cal, then Regional Center automatically funds for ABA services. All right. We're good. Keep it going.
All right, moving on. Oh. So we're here in this journey with families, right? They came in through the regional center, we've made them eligible, and now the child is 2.5, they're 30 months of age. This is when we're going to start discussing that transition to the school district. Reason being, remember, our early start services will end at the age of 3. We don't want the child to experience a lapse in services, for the families to be left with no supports. So we're going to start linking our families to their local school district. We will hold a transition meeting with the school district representative. So it's typically the school district, the family, and the service coordinator. We all meet and we discuss the next steps in the assessment and eligibility through the school district. This is an opportunity for the family to highlight their concerns, the child's strengths, and really discuss, what are they concerned about? What would they like for the child to receive? The team will ask a series of questions. The school district team will go ahead and ask a series of questions and determine what type of assessment would best fit the child. Sometimes there are only language concerns. So typically the school team will go ahead and say, we're only doing a language assessment, or we're noticing delays in all areas of development. The school will go ahead and refer for an overall assessment. The last step in this process is that IEP. The IEP should be held on or by the child's 3rd birthday. So all children, because their services with regional centers conclude at the age of 3, they should be ready to transition to their school district the following day, really. In a perfect world, right? The following day. Sometimes there may be a lapse of a week or so, but they've already been connected. They have the service. They have an anticipated start date. So our goal is, again, for these families not to be left without any services. Transition meetings with the school district are mandatory for us. So all children, all families have the option to hold that transition meeting at least 90 days prior to that child's third birthday. So if you're working with a family, they have a service coordinator, everyone has that option. And it is the law. So yes, we are providing our families that option to meet with their school district representative. I also want to point out that this is optional. We want to give families choices. So should they choose to decline that transition, they don't want to be for the child to be assessed, we can go ahead and waive that as well. I see questions. I have a client that, and this was not done. How can I assist her? This child is 4 and still in diapers due to a medical issue. I call the school and they never responded. So typically, if they are over the age of 3, this is what we call a self-referral from the parent. The parent will have to go to their local school district, but we have special education consultants. We have community providers such as Learning Rights, Task. We can send referrals for families so they can assist with the advocacy in requesting services for through the school district.
In summary, have them reach out to their service coordinator, and we're going to have our contact information at the end for you all to have. And we encourage you, if you're encountering, shoot us an email, preferably over call, but you can call as well. And we can provide follow-up and guidance as to who it is, as long as they are Harbor Regional Center. If they're, again, we're going to provide the slides to look at the zip codes. But the service coordinator should be able to assist the family to do receive guidance, support, and advocacy through the school. And then, go ahead.
Should the SC be the one to initiate the transition meeting? Yes, the SCs will, the service coordinators will go ahead and schedule the transition meetings. They're the ones that coordinate the dates. They communicate with the school district representative and the family to establish those dates. Regarding substance abuse during pregnancy, does this criteria alone meet criteria to have a referral for services? Should this referral be made automatically, or should this referral be made when we see a delay? If it's documented, if you have it in medical records, the family has this, that referral is typically made automatically. And we're typically seeing these referrals from DCFS or the clinics out in the community, the hospitals. But if you are working with a family, you are noticing a delay, yes, refer. What if the family's not planning on putting a child in preschool after 3 years old? How can they continue to receive services if they are not connected to a preschool and school district? So I just want to remind you all, services with regional center end at 3. And after that, if family declines to pursue services through the school district, families can continue to access services through their health insurance. So services can be offered through the health insurance as well, or the health plan.
I think I want to clarify a part of that. So they end at, early start services end at 3 years old. So in order to continue to receive services through regional center, they would have to have.
Griselda, you're muted.
I know, I realized that. I don't know how much of it I was muted, but I'm just going to start over. Took me long enough to have a tech issue. Early start ends at age 3, but if they want to continue to have services past the age of 3, we're going to discuss in a little bit what the eligibility criteria is in order to continue to receive supports from regional center. So it's very common that parents don't want their children to go to the school system at age 3. So they either go to Head Start, or again, they just go back to the school system when they're ready. But it gets kind of confusing because we're discussing early start laws, which is birth to 3, and then it's a whole different set of laws from age 3 and different eligibility criteria after the age of 3.
What about provisional eligibility? Great question. We are going to be talking all about provisional eligibility a few slides down. So yes, we're going to be touching up on that. Or for women who are incarcerated and some come in not knowing they are pregnant or perhaps may not know and have been using. If they have a social worker or any type of support that's helping them while they're navigating that system, I would encourage them to have a conversation. The child can still be referred to the regional center.
And one of the major takeaways we want to say, when in doubt, refer, because the worst thing that's gonna happen is we're gonna do a developmental assessment for early start, and they are not gonna meet criteria, and everybody's at ease and peace knowing that everything's going according to plan. So I know we talk about a lot of logistics, but if in doubt, just refer so that we can assess and make sure we can provide assistance. Insurance. So if early start services end, they must access their services through insurance. So if they were an early start receiving OT, occupational therapy, physical therapy, or speech services, then they will seek their insurance to continue those services.
And I just wanted to add to that as well. If it's a medical issue, there are multiple community agencies, providers that can also support with services. So we also have California Children's Services, or CCS for short. They have their own eligibility criteria. That's a training for another day, but they also can assess and determine if a child is eligible for services if it's medical in nature. All righty. So when would you refer to the regional center? And I think we've mentioned it multiple times. If the parent is expressing a concern, if you are noticing that the child's not doing something that they should typically be doing for their age, you're using those ages and stages, the CDC milestone trackers, and you're noting a delay, refer them to the regional center, right? As Griselda mentioned, the worst thing we're going to do is complete an assessment and either inform the family they may not be eligible for services or they are. If there's ever a doubt, refer them out. Our team is the one that completes those evaluations, so leave it up to them to complete those evaluations and determine the need for services. The CDC does a great job, and the ages and stages does as well. And they develop tools that can be shared with families, right? We can provide them hangouts, you can order books, and do, learning opportunities for your kiddos. But these are some of the delays that we've recognized here at Harbor Regional. Our PT, OT, our speech and language consultant, they've identified these as some of the delays that we're seeing that some parents are not recognizing, right? So we're talking crawling, walking at a certain age. These are some of the ones that we are definitely noting, and we're getting those delays late. We're getting those referrals later on, so closer to the child being 3. We want parents to be aware, what should they be noticing when their child is between the ages of 0 to 6 months? When the child's 2 years, right? Are they following 2-step and 3-step instructions? Are they using sentences or 2 to 3 word sentences? Are they running, pointing to body parts? We want to make sure our kiddos are there. So if you're in doubt, please, please, please refer. And this is just one more tool in addition to the plethora of tools that you guys are already using. If you're doing home visitation, if you're doing parent education, this is just one more to add to your repertoire. All righty, we have some questions. That's true, that has happened to my client, and they were relieved they did not need the services and ready to move forward with meeting the child where they're at. Yes, we'd love to hear that as well. So we do get some referrals, right, from concerned parents, and they just want to be told, like, yes, your child there's a delay, and they need services, or no, you're good, nothing to worry about. And that's ultimately our goal. Please share with us the advocacy services for parents who are navigating the school system after age 3 for developmental delay. Laurel, maybe I can send you some links of some of those agencies that we can share with our providers. Yeah, I have experienced a client where pediatrician documented the child has ASD and the child was then referred but not found eligible. Do you recommend appealing or know why that might be when it is observed by mental health team and as well that the child is delayed? We do see this quite often. Pediatricians determining a child being eligible for ASD, I want to point out that we're very cautious when how we interpret that information and when we're communicating with families. It depends on the type of assessment that the pediatrician completed, right? And typically what we see is a questionnaire. The pediatrician may have asked a few questions, and they diagnose this child as ASD. This may not mean that the child is going to be eligible with us for Lanterman services, but if there's enough delay, we can make that child eligible for early start services. Okay, so our team is still going to assess. If the family is not in agreement with regional center outcomes, they can always have the right to appeal. Yes, they have the right to appeal.
We're gonna get this last question, and then we're gonna keep moving it along just in the interest of time. And then Laurel and the team will help us address those questions towards the end, just to ensure we get it across. And just to piggyback off of Maria, the biggest barrier we encounter community physicians is misinforming families that, believe it or not, we get prescriptions with autism. There has to be testing in order to give a diagnosis. So obviously families come in with the prescription from a doctor saying my kid has autism, and it becomes a very difficult situation for us to explain to family that there needs to be assessments done for such a lifelong diagnosis. So that is one of our biggest. It continues to happen. I know it sounds crazy, but yeah, we get prescriptions on notepads, but so we'll keep going. I can see Laurel's face. We'll keep going, and then we will try to get to other questions at the end so that we can just kind of keep it going as we have the portion of over 3 still to go.
All righty. So that was it for my portion. I hope that was informative, and Griselda's going to go ahead and take over. Take it on, Griselda.
Yes. Thank you. So I know, just to clarify again, we've been talking about both early start services, which is birth to 3, and now we're going to talk about what happens once 3 comes around. What are the options, and what does regional service do for families at this point? Next slide. So our intake application process is significantly different than early start. You can either apply online, and just like early start, you don't need a formal professional referral. Anyone can apply online. You know, we always try to encourage parents that you know your kids best. Say you are working with the family and you definitely think that they should come to us. You can complete this online application with families. And even more so, you guys are getting, you know, kind of one-on-one connections here. If you do apply online, you can shoot us an email and say, you know, we applied this one, and we can help track it and facilitate, make sure it's going through the proper resources and the right places to get information and follow up. So this tells you how to apply online. We've tried to simplify it as much as possible. You just go online and apply, and then we provided the main number. Should you have questions, you can just let the receptionist know you're applying, and they will send you into our intake department. Harbor Regional Center has an intake department for early start and over 3 and over. Next, Maria. So our intake assessment process, we do the application. Family will receive a call from a screener to make sure this is the proper place family is supposed to be at. We often get incorrect referrals, 90% of the time being mental health. We are not a mental health agency. So we have to inform family about what our criteria is. And that's why we enjoy coming out into the community and reaching all of you guys so that there's no misunderstandings. We're not wasting time with family. We're not misguiding them, but in sharing what our eligibility is. Mental health is not one of them. Any mental health diagnosis, we can work with our families that have dual diagnoses, but they must have one of our eligible diagnoses. Once that is done and we realize family is in the right place, they will get assigned a service coordinator at intake, which will complete a psychosocial assessment, which is kind of an intake, right? Let's meet with family or meet with individuals. What does your day-to-day look like? What are your struggles? What are your barriers? What's your history? Then that's followed by a psychological evaluation. Once the psychological evaluation takes place, a feedback session must be had with either the families or the individuals as to what the diagnosis of that psychological evaluation determined. And then the last part is eligibility determination. Once you are given Lanterman eligibility, that is for life. We can never remove that eligibility. So we have 3 departments at Harbor. We have early start, which is birth to about age 7. Then they go to children's, which is 7 to out of school, which is either 18 or 22. And then we have our adults department, which is out of school to end of life. So those supports look different. So again, just reminding you all that we cannot do psychological evaluations to determine mental health diagnosis, and we do not cannot connect or provide mental health services. Next slide. What are eligible diagnoses? This is where it sometimes gets confusing to families. So we have autism, we have intellectual disability, we have conditions similar to intellectual disability. This one existed before provisional eligibility was around. And sometimes we have some individuals we know need support, we know are encountering day-to-day barriers, we know there's significant struggles going on, but they don't meet the criteria of autism, intellectual disability, or cerebral palsy, or epilepsy. So we meet with our committee and we present the case and see where are their deficits, where are their significant deficits. And if we believe there is a day-to-day, then that's that 5th category. That's that condition similar to intellectual disability. So it kind of mirrors what intellectual disability without the intellectual disability diagnosis. Again, cerebral palsy and epilepsy. And our newest one, which we are happy, is provisional eligibility. And more so happy because we are from early start. Oftentimes we had kiddos that we would close at age 3 because there was no diagnosis. And then they would come back at age 5. We missed that gray area because of that lacking of a straight diagnosis. So provisional eligibility allows us to kind of keep those families that are in the gray. We're not really sure if there's a lifelong diagnosis, but there's definitely supports. So there has to be a percent criteria. We review. Again, everything is done by a clinical committee to ensure that we can meet families' needs. Next. What is provisional eligibility? Again, this is the newest diagnosis, out there for regional centers. So we just want to give some clarifying information as to what it means, because again, we communicate through all of you to make sure we inform our community partners and our families what is what. So provisional eligibility is only for ages 3 to 5. Again, remember, we want to capture that newly recent exited early childhood kid, but we're not really sure where they're at. It goes up to the age 5. So it's important that this provisional is not lifelong eligibility. It is temporary until the age 5. Then we reassess we do another psychological evaluation before they turn 5, 90 days before they turn 5, to see if there is in fact a diagnosis, lifelong diagnosis, or if whatever services family has put into place, interventions, have now assisted the kiddo and they are meeting milestones and they're where they're supposed to be, then regional center closes. Next slide. What happens? So similarly to early childhood, where we do it IFSP, Individual Family Service Plan, over the age of 3, it's called an individual person-centered plan. Same background. You can invite whoever is part of your village, your team, whoever supports and helps you provide care. Anyone that is involved in the individual's life is more than welcome to come to this meeting. It's a collaborative meeting with us and family. It's a document. We consider it a contract as to what family is going to do, what we are going to do. It holds us accountable. And it's a document to help families also. We really like when families take our reports to the school, to the doctors, to SSI. These reports should it should give anyone an idea of what the day-to-day is for the individuals we are serving. So I was still going to say any questions, but I just see the little chat going. Next slide, Maria. Similarly, again, what is the role of the service coordinator? We first and foremost really want you all to understand that we work in collaboration with family. We often tell families when you're at home and you're really concerned and stressed and you're like, what am I going to do? How can I do this? Where do I go? Call us, because odds are we know the answer. We know a provider, we know a program. So we really just want the service coordinator to really be part of the family's life. We want to remove, educate, and most importantly, empower families. If you are here, we are going to be part of a system for the remaining of life, right? So how do we empower you to make sure your rights are being met so that you can access services? So we want to connect. We help families advocate. We monitor. We have our meetings. Unlike the early childhood, our over 3 meetings are once a year or as needed by families. So it's not like you have to hold this until next year when I see you at the month of birth. No, families can call and hold a meeting at any time. Service coordinators can attend IEP meetings with families, although we are not education specialists. We can definitely attend and identify any resources that we can support family with. We really want to become a part of the family circle of support. And one thing I also want to mention to you all is that every professional family can encounter in the community, such as physicians, clinicians, we have one to mirror here at Harbor. So that's another part of the service coordinator. If a family is having medical concerns and they feel their doctor is not providing, then I'm going to go into another slide about services that we support, but we can provide guidance on that as well. Next slide. The type of supports, we obviously want to connect families with natural supports. Our individuals are going to benefit the most from those people that are around them, that love them and support them. So we're always going to seek, who are your natural supports? Who are your neighbors? Who are your church members? Who are your community? How do we involve them? How do we include them? How do we make them part of this day-to-day life? Followed by publicly funded resources. As you guys have heard, we access insurance, community resources, because we are the payer of last resort. So we're always going to seek what are those options first. And that does not look like where we tell the parent, well, I don't know, we're the payer of last resort, go find it somewhere else. No, we navigate that process with family. We hold their hand. We oftentimes, so many service coordinators will be on a call, on three-way with insurance, not kind of showing families how to make those calls. And then lastly, regional center funded services. Next slide. So this is kind of a quick snapshot of services. I do want to urge you all that, these brochures are online on our website, but it's not a menu of services, right? And sometimes that becomes interesting with families because they see a service. We assess. A family can call their service coordinator and ask for everything on this list, and we will assess for every single service, but that does not mean that the family qualifies for every single service. So again, assessment and consultation, we can consult with our own behaviorists, with our own physicians, with our own pharmacists, nurses, you name it, we have it. A family is encountering an issue with their own via insurance or physician, come talk to us. We can come as consult. And oftentimes our physicians will pick up the phone and call their physicians. And those are some interesting conversations. So again, our biggest one that we consult with is our ABA services. Because we all know that once upon a time, maybe a few years ago, regional center would fund all ABA services, which means there were Q&A. Now insurances fund that, and we have no quality insurance, and all of a sudden there's behaviorists everywhere. So what we don't want to happen is for our families to have the same goals for 3 years with the same interventions and there's no progress. So we consult with our behaviors. We look at those reports. Sometimes our behaviors even go out into the sessions to provide guidance to family, educational support, and all those areas. Again, family support. We provide a lot of trainings, a lot of opportunities for families to educate and inform themselves through community trainings, community presentations, service coordination. We have 24-hour emergency response. And we should probably reward that because there's always someone on call here at Harbor Regional Center. So after 5 p.m. all year long, there's always a manager on call. But again, we are emergency in the sense that you can call us and we can provide guidance, but it's always if there's an emergency, you need to call 911. But there's always someone on call. We can provide assistance with medical equipment and supplies. We have our own dental person. Sometimes we cannot get our individuals to go to the dentist, right? So we need to make sure what's happening. So we can consult with our dental hygienists and again, with our nurses and our physicians. We provide assistance with after school care. This is important to know that this must be connected to the diagnosis. It's not because parents can't necessarily afford it or don't like that local after school care. This means that your individual has either been removed from after school care because of behaviors connected to the disability, or you can't find a placement because for some reason they just all of a sudden have no spaces. So we can provide after school care. Again, behavioral classes, as we had talked earlier. Respite care is giving the parents a break. We contract with an agency, or they can assign someone that does not live in the home to give parents a break. And then actually sometimes we have families that stay in the home because they don't really necessarily trust someone else in the home with their loved one, but the parent might be in the backyard with friends and there's someone in the front taking care of their child. So it's used in the way to give parent a break from providing care to their loved one. Social skills is, we all know sometimes our population needs to know how to interact. So we have social skills program to teach them boundaries, how to interact with the community, how to approach people, how to, those day-to-day skills you need to interact with the community. And lastly, social recreation. We do fund social recreation, 1 activity per quarter. So we can fund 4 activities. And there is no cap at this time. So people want to go to camp, we can fund for that if that's a quarter, swimming, horseback. So again, an array of social activities that we can reimburse family or provider if they are a vendor with us. Again, this is a quick snapshot of usual services that we provide. And again, we encourage you all to check our website out. Next slide. We also have this amazing thing that mimics a library. It's a family resource center with a whole building full of office building, I should say, full of books pertaining to anything with developmental disabilities. You have a question, they have a book. And if they don't have a book, we have an amazing Maria Elena that's there. If the book exists, she will find it for you. She will purchase it. So it's a library. I like to call it a library, but it's a family resource center. Here you find information about Sibling Club. This is a non-mental health sibling club, but it was brought to our attention from parents many, many years ago that siblings of our clients were feeling some kind of way. They didn't know if other homes looked like their homes. They didn't know if other siblings looked like their siblings. They were having a hard time understanding why their sibling got away with things they did not get. So this is kind of, again, not mental health led. It's actually led by our service coordinators. And it's a space for them to come together with other kids to share their experiences. There's arts and crafts. It's just an opportunity for them to come to a safe space together with families like their own, siblings like themselves. We are very proud of our parent mentor and support groups. We have support groups in an array of languages. Again, creating a space for parents to go talk to parents that understand their fears, what they're navigating, what they've encountered, the barriers. Oftentimes these support groups, they become family. So again, we can provide that online, what groups they are, what times. We have a parent mentor program. We understand that sometimes some of our parents might need a little bit more hand over hand. They might need a little bit more attention in navigating some processes or systems. So we can connect them to a parent mentor. It is a parent of one of our individuals in the agencies that we connect to another parent where they can kind of connect. They might be having trouble accessing Social Security or accessing another service. That parent, in addition to the service coordinator, will help that family navigate that barrier. Assistive Technology Center, it's also in the Resource Center. Developmental Toy Lending Library, this is one of our biggest hit. We all know kids' attention span kind of just is very short. It's expensive to buy toys, so we have a toy lending library. And the really cool part about this is that our clinicians have put together these amazing little cards in each toy in their bag. And yes, you can play with it, but you can also make it a learning experience, and it gives you guidance and how to do that with your kid. We have Together from the Start classes, again, led by, these classes are special because they're led by our speech pathologists for the most part, but also our occupational therapists and our physical therapists. And you get an array of topics. And we have 5 resource centers in our catchment area. We have one here at Harbor in Torrance. We have a smaller version of it in our Long Beach satellite office. Then we are connected to one at Miller's Hospital. And then we have one in Harbor City and Norwalk. So again, if you are interested in that, you can contact us or definitely check out our website. All these resource centers offer an abundance of parent training. So if anything, even, and they don't necessarily have to be Harbor Regional Center clients to attend those trainings. Someone asked about the educational one, Task, earlier. Task is infamous for presenting at our regional centers. So definitely check those out. Again, we'll give Laurel some links, some information, and she will, blast it to everyone to have that information. Next, how do you contact us? Again, check out our website. We just updated it and it's still kind of in progress, but we're very proud of the progress that's coming along. The applications, again, we provided the early start intake phone number, that's 0 to 3, and intake over 3. Those are the direct phone numbers to those intake departments. But again, Maria and I offer ourselves. We're going to provide you our contact if you have a question, if you just need clarification, or you're following up an application, please contact us, and it's okay. We will delegate if need be. We will follow up and we will reply to you, because again, we want to honor what the family needs are. And there's so many misconceptions in the community. So we welcome any questions you might have that might, kind of clear up all those misunderstandings out there.
All right, we have some questions in the chat, so I'll start with the last one. So how is substantial disability determined? Are there guidelines every regional center follows? Yes, there are guidelines that we all follow, but remember, we are 21 regional centers, and although we are governed under the same set of laws, we all interpret the law a little bit differently. So here for us, for Harbor, we've established a guideline for all of it internally. We all review cases, our staff reviews cases with us. And also our team, we have a clinical consultation team that will review psychological evaluations, medical records, developmental evaluations to see if a child is eligible under that substantial disability criteria as well. So again, every regional center, same set of laws, but we may interpret them a little bit differently. I think these this question, how many days before 5 for the reassessment? 90 days. So we start the referral process for a psychological evaluation 90 days prior to the child's 5th birthday. Okay, I do want to point out that we have a little bit of a delay because all our psychologists are at max capacity. We are having kids coming in, our kiddos coming in through our intake process, both for early start and Lanterman, and our psychologists are being booked up, but they generally should have a new psychological evaluation prior to the age of 5. Also, does every regional center in LA County have provisional eligibility? Yes, that is statewide. All regional centers have that as an option. And it's only applicable for kiddos between the ages from 3 to 5. Again, if the child's 6, we cannot make them eligible for provisional. 6, 7, any age above that, we would have to determine full Lanterman eligibility. Do you assist with IHSS as well? We can assist families with navigating that system. We, as Griselda mentioned, our family resource centers, they have a plethora of resources. We have tons of information on IHSS, and our staff can also help you with navigating the IHSS system. What can NSC do if there is a long wait for a service to bridge that gap, particularly behavioral services, or is there not much regional centers can do but wait? So that one's a little bit tricky. All of our behavioral services are impacted. They are long wait lists, and I also want to point out that we are also working with the same providers that most health plans are working with. So if they are experiencing a delay, we most likely will experience a delay as well. But if the family has a challenge, they are in a wait list for maybe a year or 2, have them connect with their service coordinator. We can perhaps help expedite that process a bit. We work with multiple ABA providers, so we can perhaps start the referral with another provider and then transition them to their health plan. Where is the information regarding the caregiver parenting classes? This is something my staff gets asked about often. Supportive classes for caregivers, parents, and can caregivers who have older children attend, or only caregivers with children actively enrolled with the regional center. So this are our parenting or classes, our TFS, anything that we offered is for families that have children or family members that are part of the regional center.
But the resource centers can offer different classes that you don't have to necessarily be part. It's a together from the start. The ones that are housed at our office buildings, those you must be part of regional center.
Yeah.
So, yeah. Sorry if I didn't explain that earlier.
How much respite is provided? I have a set of triplets, 2.5-year-olds on my caseload that haven't been officially diagnosed with autism, but are presenting with behaviors. Family is needing extra support. So respite is one of those services that we do assess on a case-by-case basis. It is not typically a service that we fund for under the age of 3. However, if there is a need, if the family needs support, there's a challenge, have that family reach out to their service coordinator, and that service coordinator will meet with the manager to see what can we do to support the family. Our support groups virtual or in person, that is, they are hybrid. I believe some support groups are back to being in person, particularly those in Long Beach, but we do have some support groups that are continue to meet virtually.
Is the sibling club exclusive to HRC? Yes, for the sibling club, they must be Harbor Regional clients to attend that. Are the quarterly activities only for Lanterman eligible, or would 0 to 3 families be able to access these services? I'm not sure if I missed quarterly activities. I'm not sure with that.
I think that came up when we were discussing social recreational activities. So yes, that is a service that is exclusively over the age of 3. And we're actually just reviewing the law that came about for social recreational activities. So we can confidently say over the age of 3.
Till, what was it, 17 to 17?
Yeah, 3 to 17 years of age. Yep.
Yeah. Once families are connected to the district, are they no longer linked to regional center? If they have an eligibility diagnosis after the age of 3, yes, absolutely, we are still part of their support group. If they do not have an eligibility after the age of 3, then no, they are no longer linked to us. Parent, mentor, and support groups. Does the website have more detailed information on these? Yes, and then we have a calendar of events on our website as well. And when we give Laura the name, they all have Instagrams and social media. So I would recommend also following them and following our Instagram, because they often place so many meetings and trainings on there as well. Will there be delay with self-referral versus pediatrician referral to regional center? I heard self-referral takes longer. No, you just apply online and it's the same process. Actually, it's the exact same process, whether a family self-referrals or a pediatrician sends us paperwork. It's the same timeline, because once we receive that information, clock starts ticking. So it does not really matter where it came from. Will this recording be available for review? Laurel says yes. Wait, oh, she already answered that one. Can little ones an early start ever access the HCB SCD waiver, institutional deeming, if there are exigent circumstances where they're an early start? This is only a Lanterman. We are very cautious about making an early start client a Lanterman client. Has it happened? Yes, it's a discussion to have. To be quite honest, we're gonna look at what can we exhaust? What are we gonna benefit from making a baby a status 2 if we're not really sure what the long term, right? Everyone here believes in early intervention, and our hope is that most of our kiddos perhaps are not, long term clients with services, but it can happen. But it is only usually over the age of 3. But Caroline, if you have a specific situation, you can reach out to us and we can discuss, or have the family discuss that with their service coordinator. And just to remind you all, every service coordinator's business card has the manager supervisor on the backside contact information. And we all encourage families to call us. Sometimes families feel, I don't want to tell anyone. We're part of the support system. Service coordinators sometimes aren't in the field, they're busy. You need help, someone else is calling you about something, call us. We can provide help too. Can parents with children 0 to 2 apply online? Yes, they can. Can you please add the regional center link here, as we will not serve the zip codes for the link for application, or the link for which regional center the zip codes belong to? We can look at that. So I guess, Maria, they're asking for the DDS website, which
Yes,
is
and
Lynette. Thank you, Lynette, already.
Lynette.
I'm
Yeah.
behind. I was processing. How long does it typically take for service to be coordinated and put into place? For early start, we have 45 days to determine eligibility. Once that meeting is held, we have an additional 45 days to put that service into place. Whew, I think we got them.
Yes, so many questions, and these are great. We encourage you all, if you have any questions, I mean, I know this is an opportunity to share those, but also reach out to us individually. Griselda has already mentioned, she's gonna share our contact information. So send us an email, give us a telephone call. We are here to help you and answer your questions.
And we appreciate all these questions, because this gives us an idea of what we need to put in our presentations, what the questions are happening in the community, where we need to do a better job of, pinpointing clarification. So we really appreciate everyone's time and questions, because it really helps us guide what information needs to reach the community to avoid delaying, misunderstanding, informing families.
I cannot believe you got through all of those questions. That was amazing. You guys are truly the experts here. So before we put up our link for our evaluation for this, can we all just give Maria and Griselda a silent round of applause? Give them some love in the chat. This was such an amazing and super, super helpful webinar. And it wouldn't be an LABBN training if we didn't share a little evaluation for you all to take. I'll put the QR code up on our screen here, so you can just scan that if you'd like. And I also put the link in the chat. So either way, you can take that evaluation for us. That would be really great. Let me check the chat here one more time. You guys are just getting a lot of love in the chat. Very, very informative. Thank you very much for a very good presentation. Thank you. Caroline, yeah, they are going to provide their specific contact info. I think we'll send that out with all the follow-up materials. All right.
And, just to close it off again, we really urge you all to contact us if you have questions. We try to and capture so much of what we do on a few slides. And, if you are still wondering about something, please let us know.
All right. Well, with that, I will stop my screen sharing. And just thank you all once again. Thank you so much for joining us. Louise, the PowerPoint will be sent out with the meeting follow-up materials. Yeah. All right. So thank you all so much. Have a wonderful day. Keep your eyes open for our follow-up materials. Thank you.